So I think all of us in our careers all have a memorable, that experience. I think all of us can look back to where we were on September 11th and tell, remember exactly what we're doing. For those of you, I wasn't alive when Kennedy was shot, but my parents talk about knowing exactly where they were, that was one of those moments. And so I can tell you that if I hope that I'm able to still tell you this when I retire in 18 years, and that is that probably May 22nd of 2011 was my most memorable career day. And good memories, bad memories, learned a ton of stuff, forgettable memories, things that you want to move on from, but really it has shaped a lot of how I've looked at doing things differently along the way. And so today I appreciate the opportunity. We've been working on trying to figure out how to get this done for a year or so, and we just had a day that worked for everybody. So I appreciate the opportunity to get to come and share the story. I am going to try to move through the slides reasonably quickly, because I think there's a lot of value in having a discussion when I'm done with the slides and letting you guys ask questions, because I'm sure I'm not going to cover all of the things that matter to you and to your organization. And so if I don't, please ask those questions. If I don't have the answer, I'll make it up, or I'll find an answer for you. So, and the other thing is, I do have to leave after my presentation, but I'm going to leave with Travis some of my business cards with the contact information on it, so that if you have a question later, or you think of something or want something else, please feel free to get a hold of me. And I assume that the presentation is available to them online or something too. So anyway, with that, let's talk about, so as you said, I had 24 years of experience. I've served multiple roles in different organizations. So I worked in a small rural area, then I moved to a metropolitan area in Kansas City, serving a population of about 2 million people. I had worked my way up to a battalion chief there, and then got offered the chief's job in my original hometown, and moved there and was the chief there for 11 years, and had decided it was time to move to something a little bit bigger, and got the opportunity to come to Kootenai County, Idaho. As with my experience in Kansas City and in Southeast Kansas, I was a NIMS and ICS instructor and still am. Served as one of the 3 incident commanders on the Kansas incident management team. We were a 27-member Type 3 team that served the state of Kansas, and I was one of the 3 incident commanders. I was the deputy commander for the EMS response team in Kansas, so we had a crew that would go in and set up triage, treatment, and run the EMS operation for a disaster. I've, over the course of my career, been to 7 tornadoes. I've responded on 3 EMAC requests out of the state of Kansas, 1 for flooding and 2 for hurricanes. We had a great relationship with the state of Mississippi, only because when Hurricane Katrina happened, everybody said, oh, we got to go help New Orleans, not realizing that the state of Mississippi was really the one that was hit. And us good old boys from Kansas went to Mississippi because no one would think to call anybody from Kansas to go to Louisiana. So we drove right past Louisiana onto Mississippi. And so then when Hurricane Gustav happened about 4 years after that, they actually sent a Mississippi National Guard plane up and flew a group of our incident management team to Mississippi, and we went down for 2 weeks and helped them manage a hurricane. So all of those were incredible experiences that I had. And now, for the last 2.5 years, as Ed said, I've been the chief over in Kootenai County, and it's, the interesting thing is we haven't experienced a lot of disasters or on those type of scale disasters. So I can tell you it's been a little bit of a slow process to get us up, but now we have this incredible opportunity called Cascadia Rising. So we've been thinking about this, and we needed to really reshape our mass casualty incident plan. And so I'm going to talk a little bit about that today, as well as the things that we've done just in the recent and in the past about year to make those changes and make them effective, not just for Cascadia Rising, but for just any kind of looking at an all hazards approach to everything. Because I think any of us as organizations, it doesn't matter whether you're an emergency response organization, a healthcare organization, a planning organization like emergency management, or just a community health partner, I think that you've got to look at some sort of a all hazards approach, and we're going to talk a little bit about that today. So Joplin is the 4th largest metropolitan area in Missouri. It has a population of 52,000 people, roughly the same size as Coeur d'Alene, Idaho. It was really, so the 4 states, so southeast Kansas, southwest Missouri, northwest Arkansas, and northeast Oklahoma all kind of met at the 4 corners. And so it was the retail hub, though, and the medical hub of the 4 states. That's where everybody went to go to the mall or go to the, retail shopping. It's certainly where, for instance, from my smaller community, we sent people when they needed health care, significant health care. So if you were having, that was our nearest trauma center, or our nearest level 2 trauma center. It was certainly where you went if you were having a STEMI or a stroke or some of those time-sensitive emergencies. So and their metro population is about 160,000, although during the day it swells to about 240,000 people. And so I think we were just really lucky that the tornado happened on a Sunday afternoon, and we'll talk a little bit about some of the reasons. It's got a state university. It is a major industrial center. It has 2 interstates running through it, and then it's also got a regional airport. And all those are key things as we go along here. So the storm. I can tell you that my wife and kids and I were at my niece's birthday party about an hour and a half north of our house, and about 2 o'clock the Weather Service started sending things out. And I will tell you, we lived and died by the weather in the Midwest. I mean, we were plugged in. Our phones, I always said, if you woke up and saw Jim Cantori broadcasting live from your driveway, duck and cover because you're about to get hit. And so that day, guess what? The first indication anything was wrong was I got a page from a friend of mine on the fire, or a text from a friend of mine in the fire department saying, hey, why is the Weather Channel's TIV, their tornado intercept vehicle, why is it here? It's at the Walmart parking lot. I'm like, well, that can't be good. I doubt they're just stopping for bottled water. So we start thinking about it. At about 3 o'clock, the Weather Service says, really ugly. And what I, of course, was trying to be a good husband and father and uncle, and so was not paying attention to any of this and looking at the TV. But apparently, if you ever look at the Weather Channel, and I'm a weather geek, so I will admit to doing that, they normally have, the red zone and the yellow zone and the orange zone. Well, that day they used a white zone, and they've only used that like 3 times in the history of the Weather Channel. And so that day, guess what? Southeast Kansas and southwest Missouri were in the white zone. So we start heading home because my phone starts blowing up with warnings and watches and this. I said, we really need to go. We're driving home, and the storm was so impressive I could see it from 90 miles north. And it was, thunderstorms are measured in heights, and so it was so high I couldn't see the tops. And so we were just really amazed. So at 4:37, the first tornado warning happened in the county I lived in, and that was Labette County. And so it comes out, and it's very unusual because tornadoes normally move on a track from the southwest to the northeast, and this was moving from the northwest to the southeast. So something was amiss already. The other thing was they were reporting immediately softball-size hail. Any storm that has hail greater than golf ball size has a 75% chance of producing a tornado. So we know right away that as soon as we hear softball-size hail and rotation and things like that, it's going to be bad. So the warnings continue on for Cherokee County, which was the county southeast, and the county in between our county and Joplin. So we have damage. We don't have a tornado, but we have significant damage due to the softball-sized hail and wind speeds of over 100 miles an hour in several spots. But we don't have any injuries reported, and we're pretty lucky and we're pretty good. Cherokee County has a few injuries. At 1734, the security guard at St. John's Hospital called code gray or condition gray, which meant an imminent warning for a tornado. And thank God he did, because I will tell you, the Weather Service has studied this since then. They could not believe Joplin was the largest single tornado death toll since 1959, and I believe that tornado was in Alabama. Now that same year there were all the tornadoes in Alabama, and they had a huge outbreak, and it also killed about 160 some people, but it was multiple tornadoes all over the state. So they call the condition gray, And the reason that that's so important, and the reason that they think 161 people died in Joplin that day, is because people didn't heed the warning because they were so immune to getting warnings. That it happened so often that people didn't even think about it. And what does everybody in the Midwest do when they hear the tornado siren go off? They go out on their front porch and look. Well, that's exactly what happened, and 161 people died. So at 1741, the EF5 tornado strikes the city limit of Joplin. So for any of you who just enjoy following any of this or want to read a really good book, one of the ER doctors at St. John's wrote a brief book. It's not a long read, but it's called 20 Minutes of Hell, and it describes the 20 minutes of enduring the tornado as it went through the town of Joplin. Because tornadoes, although their wind speeds are 200 and some miles an hour, the actual tornado is moving very slowly. It's only moving at 30 or 40 miles an hour. And so it's moving and chewing up things in its path and moving very slowly. So out of that, 161 fatalities. EMS in the first about 24 hours touched 1,500 patients, and that was EMS only. So that's kind of the storm in a nutshell. The path, it hit, first of all, let me point it up here. So this is where it entered the town. This is about where St. John's Hospital is, so it hit the regional hospital first. It hit St. John's Hospital. It was a 7-story building, about 200 inpatient rooms. At that time, they had 170 patients in the hospital. They were a level 2 trauma center, and it moved the 7-story building 6 inches off its foundation. They had surgeries going on at the time. They were delivering babies at the time, and they had a full ER at the time. So all of this was happening. Several churches, all right in this area right here. Why is that important? Because the storm hit at 1741, and in the Bible Belt in the Midwest, a large segment of the population goes to church on Sunday night at 6 o'clock. Now, if the tornado had been 30 minutes later, I think the death toll would have been probably 400 or 500, because there were several churches that were leveled, and I have some pictures in here. Nursing homes, and apartment complexes, and low-income housing, all kind of in this area. Why is that important? What are nursing homes, low-income housing, and apartment complexes made of? 2x4s. They're not made of concrete. They're not made to withstand winds of 200 miles an hour. So all of those went whoosh, gone. We had a ton of fatalities in that area of low-income housing, apartments, and the nursing homes. Then it hit 9 schools, and the 9 schools are spread out all over the damaged path. And then finally it hit a huge retail area. And I don't know if many of you are familiar with Coeur d'Alene, but it kind of reminds me of Highway 95 in Coeur d'Alene, where every box store and chain restaurant and everything is right along Highway 95. They have a road called Range Line Road, which is the same thing. So Home Depot and Lowe's and Red Robin and all of those same things that look like pretty much any other town of 50,000 people in the United States have it. The problem was, what happens and I learned a ton of this afterwards because I didn't know this ahead of time. What are all of the big box stores made of? It's called tilt slab construction. So they build these 20-foot sections, 20 by 40 sections of concrete on the ground, and they tilt it up. And what are those held by? They're held together by the roofs. Well, guess what happens when the roof blows off? So if you were at Walmart or Home Depot or Lowe's or Academy Sports, what did the people tell you to do when the tornado warning went off? Go to the outside wall and seek shelter. Guess what happened? So tons of fatalities in all of those areas because of that. There was not one fatality of anybody that sought shelter in an approved tornado shelter or sought shelter in a basement. Not one fatality. So when you think about that, that's pretty amazing. So the response, over 200 EMS units, over 500 or over 75 fire departments, figuring that there were probably 500 fire trucks involved in that. Multiple USAR or urban search and rescue teams. In the state of Missouri, they call them ISTs, incident support teams, what we call an IMT. And then obviously the state and federal government was there to help. No offense to my friend in the Air Force over here. Hi, we're from the government and we're here to help. My role, so I served 3 roles in the response. My initial role, and you can see, is right over here. That is the Home Depot, or was the Home Depot. That was our initial assignment. We went over with a task force of 3 ambulances, 2 engines, and a rescue truck, myself, and I had a battalion chief and a captain with me. And we had about 16 guys on our initial task force that we went in with. Our initial assignment was Home Depot. Now keep in mind, it took us an hour to get there after we got the call. So we're probably an hour and a half or hour and 20 minutes post-tornado. We get there and there has really not been anything done to that point. We pull up and it was like moths to flames. I will never forget this. We pulled up with lights and sirens and emergency vehicles, and people started coming out of the woodwork to us. You know, people who had been injured for an hour and a half and hadn't had any treatment, and critically injured people. You can see these are mattresses that people had brought patients in like the back of a pickup and laid them on a mattress and brought them and just dropped them off to us and said, here. So I was there for about an hour and a half, and finally we got asked, or I got asked to leave the crew there, and I got asked if I could come to the EOC to provide some information. And I've got that on another slide, but I want to talk a little bit about what they didn't know and the importance of situational awareness. I was in the EOC for about 2 hours, and then Freeman Hospital, which was obviously the competing hospital. Does this sound familiar? Never 2 competing health systems in the same place. The competing health system in town, which was also a level 2 trauma center, called and said, you know, we think we have some patients to transport out. And so they looked at me and said, well, you're an EMS guy. Can you head down to Freeman and kind of get some eyes on the situation? Yeah, not a problem. I'd been to Freeman 100 times. New people there. It was a lot the same. We dealt a lot like Idaho and Spokane and Coeur d'Alene, you know, where we needed to work together. And it was, I mean, I can tell you, we've just had this conversation yesterday at our LEPC meeting. I value the relationships here in this area a lot more than I do, even though we have to go through Boise, call Boise to ask for your guys' help sometimes. I'm relying on you guys because you're 30 minutes away, and the only way to get to Boise in 30 minutes is if you have a private jet. And my friends at Life Flight haven't gotten me that yet. We're working on that. But until we get that figured out, you guys are an important key component. And so I knew the folks at Freeman. I'd worked with the folks at Freeman, and I ended up spending about the next 20 hours at Freeman working through the problems, and we'll talk a lot more about that. In the end, we transported out of Freeman. So a level 2 trauma center had all the open heart surgery and all neurosurgery, everything. We transported 312 patients out of Freeman to other trauma centers over the course of that 16 to 20 hours. So we'll talk a little bit about that. St. John's, I don't think they've gotten enough credit, and still, you know, 5 years later, they don't get enough credit. They had the warning and they knew the plan. And whoever that security guard is a hero in my mind, because how many people would really feel comfortable pulling the trigger? It's like when there's a bomb threat. How many people really take it seriously and do all the things that we're trained to do? Or how many people go, nah, somebody left a suitcase? How many people in the Brussels airport the other morning went, just another suitcase? But it was a suitcase that was packed full of nails, and it killed 11 people and injured 100 people at the airport the other morning. This guy knew what to do. He pulled the trigger. He didn't ask anybody. He didn't ask administration's permission, nothing. He said, code gray, we got to go now. He saved a ton of lives. The stories out of there where you talk about surgeons laying on top of patients in the surgery suite who were in the middle of having surgery to make sure that the patient didn't fall off the surgery table during all this. Things like that we don't ever anticipate hearing. The selflessness of all the doctors and nurses. I use the word wow because it's really an incredible story. So there were 6 people that died at St. John's, 5 of whom were patients, 1 of whom was a visitor. We hear a lot about that. 6 patients, that's horrible. What they don't tell you about is there were 170 some patients in the hospital, which means, oh wait, there were 170 patients that survived. The 5 patients that died that were in the hospital were on the 7th floor. They were all in the ICU. They were all ventilator dependent, and they were all sick as hell anyway. So guess what? These weren't stable patients that all of a sudden had a traumatic injury because of the tornado. They were patients that were really sick and because of the tornado were injured further and couldn't survive. 2 of whom got sucked out of the 7th floor window. 3 of whom got traumatically injured with other things. But these were not patients that were well to begin with and all of a sudden had significant injuries. I can tell you, in their new hospital that they built, all of their surgery suites are underground. Their ICU is on the 1st floor now, not the 7th floor. I mean, they made a lot of changes to their facility because of the things that happened and they learned. Freeman, they had an overwhelming response. I mean, so when you're used to being half of the healthcare capacity in a community and you all of a sudden become the healthcare capacity in a community, that's a huge, huge deal. They saw over 600 patients that night. They truly, it was battlefield medicine. I mean, so I've got a couple of funny stories to tell you and a couple of graphic ones, but that's okay. So how many chest tubes do you suppose that a hospital level 2 trauma center keeps on hand? 40, 50? What happens when you need 200? You know what you do? When somebody dies with a chest tube in, you get one out and you clean it real good and you reuse it. You reuse laryngoscope blades, and we don't do that ever. I mean, we throw those away and dispose of them now. It was battlefield medicine. One of the best stories was there was this poor gal, and she was I don't know whether she was in her final year of medical school or whether she was in her first year of internship. But she was in one of the rooms, in one of the trauma rooms, and a surgeon's yelling at her to get her, get a central line in this person. And she fumbles around, and finally he looks at her and, you know, after a few expletives, kind of, what the hell is going on? And she says, well, it's not sterile. And he goes, for the love of God, we haven't done anything sterile for the last 2 hours. I don't know why we're going to start now. Get the damn central line in. And it's just things like that that you really realize nothing that we do on a normal basis, on an everyday basis, is what it normally, I mean, or what it can be in a disaster. And so it took a ton of teamwork, and they bought into the teamwork. I got to say the patients did an amazing job of the teamwork. So I just got done saying that Joplin is the regional medical hub, so they're used to getting patients, and now they're going to be shipping patients that live in Joplin to Little Rock, Tulsa, Oklahoma City, St. Louis, Kansas City, Wichita, I'm sure I'm leaving Memphis. I mean, because you guys know how hard it is to find one neurosurgeon on a Friday or on a Sunday night. Wait till you need 150 neurosurgeons. That becomes more of a problem. So they did a great job. So some of our successes, we transported over 1,500 patients in that first 24-hour period. All of our primary EMS objectives were accomplished in the first 16 hours. We had amazing communications outside. So I could sit, Kansas, just like Idaho, has a 700 megahertz radio system. I was sitting on my handheld radio in the Freeman parking lot getting help from people in Wichita and Kansas City who had internet access and could get me immediate real-time hospital information and hospital availability. Never a problem. Couldn't talk to somebody 3 blocks down the street in Joplin. That was a problem. We'll talk about that. The hospitals outside did an amazing job. Again, you try to find a trauma center on a Sunday night just regularly, and now I need to transfer 312 patients. And this wasn't 312 code green patients. All the code green patients we put on school buses and sent to little local community hospitals. This was 312 patients who were all at least code yellow and a lot were code red because they all had significant fractures and they all had significant head injuries. About 100 and some of them needed neurosurgeons, and 200 of them needed an orthopedic surgeon of some. I've never seen that many hip fractures in my life. So, and the airport was amazing. They shut the airport down other than the medical helicopters and medical airplanes, and we used that as a transportation hub. We couldn't bring helicopters into the scene. It was too chaotic. There was debris everywhere. We used a total of about 14 medical helicopters and 7 fixed-wing airplanes, though. And you know what? We just sent ambulances out to the airport, and we had somebody out there coordinate it all. The tower shut everything else down. We landed helicopters on the crosswind runway that was shut down. We kept the main runway open for fixed-wing airplanes, and we had 10 or 15 ambulances out there all the time waiting. Their fuel trucks fueled the helicopters, and we flew patients, like I said, to Tulsa, to Oklahoma City, to Wichita, to Kansas City, St. Louis, Memphis, Little Rock. I think that's it. But, I mean, it worked like a charm. Failures or areas to improve on, they were failures that night. It took way too long for the local folks to grasp the scope, and they would tell you that today. I can remember going into the EOC and sitting down and they were still dispatching calls to single residents. And those of us that had been outside were like, I don't know where you think you're going to find the house number, because there's not even a house. I mean, blocks were leveled, and they were saying, well, we think we may have somebody trapped in a house at 1234 Main Street. Trapped in a house? You don't have a house at 1234 Main Street. Outside agencies could not communicate. So we've been working on this heavily with our county and your county, or Spokane County, is being able to integrate our 2 radio systems. We had the ability to integrate into their radio system. They would not allow us to have their code plug for their radios. So we had all of the technology to do it, and they wouldn't allow that to happen. And so literally I had 2 portable radios and 2 mobile radios in my command truck, and I had $15,000 worth of radio equipment, and I was using it all to talk to Wichita and Kansas City to get hospital information, because I couldn't talk to anybody in Joplin, because they have since changed their viewpoint of that, by the way. But I mean, that's one of the reasons I think it's so important for us to communicate with you all in this. There was no good way of tracking resources. So the one thing I will say, and some of you emergency management and hospital preparedness folks will probably shoot me for saying this, we rely way too much on technology for disasters. Guess what? It's all cool. Web EOC and patient and WATRAC and whatever else you guys use are really great until you don't have electricity and internet. Because then guess what? You know what my best friend was all night? A 78-cent legal pad and a blue pen from Walmart. I did all the patient tracking on that. I assigned a battalion aide. I took my captain with me to Freeman and said, do not leave my side. If I have to, I'll handcuff you. He stayed right by me. He tracked all 312 patients. At the end of the night, we didn't have internet. We didn't have computers. We didn't have cell phones. But you know what? I could produce a copy of where every patient, their triage tag number, what hospital they went to, and how they went there, whether they went by fixed wing helicopter or what ambulance took them. And so the idea that we build these systems, I think some of them are great, and they're great information tools, but we can't forget how to revert back to, I think we have become too dependent on them. And then the long-term planning took too long. And I know it's nobody's focus, but that's why you bring additional help in, because you got to have people who aren't looking at the immediate. But when you have an incident this size, this isn't a couple-day thing. This is a couple-week or a couple-month thing. But if you don't start that planning process right away, it's a bad thing. So those were probably the biggest areas that didn't go as well. So some lessons learned. I think this is an incredible lesson, and that is know your threats and be realistic to your threats. I realize, and I have people point this out all the time as I give this talk in the Inland Northwest. Well, Chris, we don't really have tornadoes up here. You're right, we don't. But we have I-90. We have an Amtrak train. We have an international airport. So it's not about making a plan for a tornado. This isn't this talk is because of a tornado, not to teach you what to do for a tornado. All of this is applicable, I hope, to any kind of disaster we may or may not encounter in the Inland Northwest. And so know your threats and be realistic to your threats, and do not pretend it can't happen to you. Because I will tell you, there are people in Joplin, Missouri that at 5:40 p.m. still were saying it can't happen to us. And at 5:41, it happened. And it amazes me today that people who have disasters and don't do well at them still say, well, we never thought it could happen to us. Lesson 2, plan. You've got to have a good disaster plan, and everybody needs to be engaged in practice. So if you have people in the plan that don't know they're in your plan, that's a failure. If you have people that need to be in the plan and aren't in the plan, that's a failure. Everybody needs to be engaged in practice. Never forget that people look for organization and leadership. They are expecting you as a leader, and the reason you're all in the room is because in some capacity, you're a leader within your organization. They are going to be looking to you to provide that leadership during a time of crisis. And people have to know their role in the plan. They've got to be practiced and understand their role. If you expect them to play and perform when it's go time, you've got to give them the opportunity to learn their role and practice their role. Plans are nothing, planning is everything, and I agree. How many of you honestly look at your plan regularly and take it off the shelf and dust the dust off? 1 out of 50. I would tell you, that's the planning process is where you strike gold. That's where it happens. It's not the actual plan. It's the fact that you pull all those people together and sit at the table and have that communications discussion and have some of those difficult discussions that are centered around that. That's what makes you successful. Be engaged and be a leader. Never cease the learning process. I can tell you, I feel very comfortable in disasters, but I still love to learn about them because, you know what, there have been several since Joplin, and I can learn something from each one of them, and everybody ought to take that approach. Network. You ought to have a network of people that you know this stuff and that you can call on, because there's nothing better than looking up and seeing some of your friends in the room and going, whew, I know Jim. I know Jim's capabilities. Thank God Jim's here. Plan, plan, plan. Practice a lot and know really talented people, because you can't be expected to do it all by yourself in a disaster. You're going to be relying on your neighbors and your friends and the people that are part of your plan, but know really talented people. So changes we've made in Kootenai County, we've instituted a MedComs process because we recognized in working with our hospital that that was probably set to be a failure in a disaster, and that wasn't anybody's fault. It was, we hadn't addressed it adequately. We now have a MedComs process. EMS is now going to put a hospital liaison at Kootenai Health as soon as we strike a third alarm MCI. We will have a chief officer from one of the departments go to Kootenai Health with a radio, with a vest that says EMS liaison, and be there for their command structure so that they have that integration with what's going on at the field. Because what does everybody want in a disaster? Real-time information, right? Not see it on CNN 6 hours later. They want real-time information. So do we in the field. So putting somebody there with a radio who can provide the hospital real-time field information, but guess what he's doing back to us in the field? Providing us real-time hospital information. That's incredibly valuable. We have decided that no matter whether we have an incident or not, we are going to exercise the plan annually and review the plan for changes every 2 years, whether we use it or not, whether we have an MCI or not. We have decided to purchase equipment. We have bought an MCI truck capable of treating 100 people, and we've bought 2 MCI trailers and stationed them in other locations in the county with the hub and spoke concept as to not put all of our eggs in one basket. We've looked at alternate care and transport facilities. So normally some of our ventilator hospitals and our rehab hospital and our specialty hospital don't have ERs, but in a disaster, we've gotten them to agree to take code green and code yellow patients, because that takes a huge load off of us and allows us to use primary hospitals both in Kootenai County and in Spokane then to receive the critical patients. We've even gotten the urgent cares to buy in, and the urgent cares are going to accept code green patients. And we have simplified everything. We took an 1.5-inch plan, and it's now, including all of the appendices and everything, 36 or 37 pages long. you know what, we didn't plan for everything. We have a plan that says, use your principles of NIMS and ICS. Here's some forms to use. No talented people. Use the communications plan, and we simplified everything because we're not trying to. I don't want you to look for page 312 of the plan when the poop hits the fan. I want you to be ready to exercise the plan. Lesson 3, NIMS. It's what's for a disaster. There are still people today when I go teach a NIMS class who will say, this is stupid. Stupid or not, argue about it or not, NIMS is what we're using. And you know what? It's what we have. You need to be engaged in the process. People, again, are looking for leadership. And when you use the NIMS system, because we've gone out and trained everybody to the NIMS system, it's what happens when we arrive at the scene. And for those of you who are chuckling, chaos does not mean Chief has arrived on scene. That's what the line guys will tell us once in a while. Remember that NIMS prevents role creep and confusion and allows people to use a system that is nationally recognized but locally known. Public messaging. This is really important. So I have a picture, again, back to my Weather Channel thing. So that's Mike Bettis, the famous tornado hunt guy. That's Mike Bettis after he drove into a tornado. One of the things that happened so poorly in Joplin that night, so I told you that the Weather Channel was in Labette County and they started chasing this tornado. The tornado hits Joplin, and what does Mike Bettis do? He gets on the Weather Channel and says, oh my God, if you know CPR, can spell CPR, ever thought about taking a CPR class or could do first aid, drive to Joplin immediately. If you're a doctor or a nurse, drive to Joplin. They need help. For those of you that are doctors or nurses, what I'm going to say, I'll pre-warn you that I'm about to offend you, and I apologize for that. The last thing I need is nurses and doctors in scrubs and their clogs. And my wife's a nurse, so I can say this because I have probably 200 pairs of clogs to match each pair of scrubs in the house. But that's not what we need digging on the rubble pile. I need firemen in protective gear and steel boots and gloves and eye protection and helmets from falling debris to dig people out of the rubble. You know where I need nurses and doctors? I need them at hospitals, because guess where the patients go once they get dug out of the rubble pile? To hospitals. That was a huge problem, huge problem. But if you don't control the message early, and the city of Joplin didn't put out a message for several hours. So when we allow the Weather Channel or CNN or Fox News or whoever you participate with to control the message, that's exactly what you're going to get. You've got to form and control the message. You've got to form partnerships with your media. I made a huge mistake as a young battalion chief one time. I didn't have time for the news. We had a fire that had 12 patients, and by God, I was busy, and I was not going to talk to the news. But you know what they did? They went and found one of the people who lived in the apartment wearing her muumuu with her wet towel on her head, and she said, well, the fire department took too long to get here, and they don't even care about us, and we didn't control the message. We looked like idiots. Control the message. Social media can be good and bad, I will tell you. I'm not a social media guy, but I have a lot of people that are. And the world today we live in, tweets and Snapchats and Instagrams. I have a teenage kid, so I know about it. I just don't participate with it. But having a mechanism to manage that media early on is important. You've got to do the greatest number of good for the greatest, or the greatest good for the greatest number of patients. When you have 1,500 patients, it takes you out of the realm of doing it normally. I think 99.9% of the time, we all do a really good job of taking care of patients. When you have 1,500, you have to make some really difficult decisions, and decisions you wouldn't normally make. And the patients are everywhere. You've got to believe that unconventional medicine and care goes into effect. You don't do it like you normally do it. I can tell you, no one got a C-collar and got C-spine like we normally did it. You were lucky to be thrown on a board and driven in a pickup to a hospital. That was really good care that night. You cannot imagine the numbers that you're dealing with. And so you need to have it in your mind that all of the things that we train for every day and all of the protocols we establish and all of the things that we do quickly go out the window, and you've got to figure out how you're going to do the greatest good for the greatest number of people. You have to pay attention to secondary MCIs. The worst thing you can do as an EMS provider is create a secondary MCI by taking everybody to one hospital. The other thing that happened that night was, what did everybody in Joplin know? They knew that St. John's was the hospital. What did they all do? When they were hurt and injured, drove to St. John's. What could St. John's no longer do? Take care of patients. Had a secondary MCI. The picture on the right there is a picture of a Walgreens store where it was like, again, moths to flames. Patients just started gathering. I don't know if they thought that Walgreens, I mean, there wasn't a thing left on a Walgreens shelf. They didn't have Band-Aids and gauze pads or anything anymore, but it quickly became a treatment center because people gathered there. Patients won't wait. Hospitals will call EMS. What does a hospital do anytime they need a transport now? They call the ambulance or they call the helicopter because that's what we do. That night, what did Freeman do? They called EMS. It's a lot different between transporting one patient and 312 patients, but they called EMS because that's what we do. You've got to decide about where the patients will go and how are they going to get there and where are they going to go and why are they going to go and all of those things. You've got to be thinking about that with a secondary MCI. Equipment, you're going to run out of equipment quickly. I can tell you that all the hospitals quickly ran out of equipment, and it was a catch-22 because you don't want area hospitals to send you a bunch of equipment because you're going to be sending them patients. So we needed a lot of basic life support supplies. We needed a lot of oxygen masks. We needed a lot of splinting. We needed backboards, and we needed bleeding control. We did not really need to get into the weeds much farther than that. Know where your resource caches are. As I mentioned a minute ago, we in Kootenai County had all of our resources in one thing. In Joplin, they did too. Guess where that trailer was parked? St. John's. They had all of their eggs for a community of 52,000 people in one MCI trailer parked at the hospital that got hit. Guess where that trailer was? I don't even know where the trailer was. They found spine boards from that trailer 7 miles away, though, the next day. So that, I mean, the one resource quickly became ineffective. Have partnerships. We know where trailers are in neighboring counties, including Spokane. You all, I assume, know our capabilities so that you can help. Don't put all your eggs in one basket. And have agreements with neighbors. Have a plan for how you're going to get a hold of them and what you're going to do and how you're going to do it. Communications, universal language. So I don't know if any of you have any background in the fire service at all, but for the USAR teams, Urban Search and Rescue, we have a universal language, and it's all drawn out and it's all symbols. So you see the USAR team guy there marking the building. So the USAR teams didn't get there for about 6 hours, though. The worst thing we did probably was we gave every volunteer fireman a spray paint can, and they went around and didn't use a universal language. So they went up and painted the V on a house for vacant. Guess what V actually means? Victim. So I will never forget the USAR commander getting there and going, holy, you can insert whatever word you like. Do you guys know what you're dealing with? And we're like, well, yeah, we think so. Well, every house we drove by has a victim in it. And we're like, what? The firemen who hadn't ever been in this situation and weren't familiar with using a universal language had gone and done what they thought was the right thing, which was to mark V on the side of every house, thinking they were meaning vacant. Again, the USAR guys who think V means victim were just not talking the same language, and it created a real problem. The inability to communicate is bad. So when winds blow 200 miles an hour, guess what happens to every cell phone and radio tower? They don't stand up anymore. They all fall down. I would tell you, even in a disaster here, what happens to cell phone towers as soon as there's a problem? What happened on the November 17th windstorm? The cell phones didn't stop working, but everybody started using them. So they were overcrowded and you didn't have effective communication. I did not have cell phone communication or internet communication for probably 12 to 15 hours. And we depend on them. I mean, that's how we communicate. And so you've got to have a plan for disaster communications and what your needs are. Like I said, have a stack of legal pads and blue pens. I can tell you, we are thankful in Idaho, and you guys do not have a statewide radio network in Washington that I know of. We're very thankful that we have a statewide radio network in Idaho. We were thankful that we had it in Kansas that night because we certainly used it a lot. So figuring out a way to communicate is really, really important. Now we've seemed to have bridged the gap with Kootenai and Spokane counties, but the second it goes outside of those two counties, we again lose the ability to communicate. So we need to start thinking about that. People, you've got to think about the toll it takes on your people. It takes a lot of people. You have to take care of your people and the people. I will tell you, this is another area that we did not do as well as we could have in, and we lost 3 employees after the Joplin tornado. One of whom just walked into my office about 2 weeks later and said, "Chief, I will never be able to do that again." He had to make decisions that he never thought he'd have to make. He pronounced people dead that weren't quite dead yet, but we knew that we're going to die and they had fatal or mortal injuries. And he just said, "I'm never going to be in that situation again." He left EMS and is now a farmer and could care less about doing it. It takes a toll. Never underestimate the toll that it takes, and get them ready for it. Not just practicing to the plan, but practice them to get some help and mental health and do some of those things to make it better for your people. Emergency services. Life is forever changed. If you have a disaster, and I'm not just talking about a tornado, if you have a disaster, you have to make it better and safer. Life has got to be different afterwards. You ask for and thank the help, and you've got to learn from others. So we should not have a disaster go on and not pick up rule or lessons learned from any disaster. We should learn from Brussels. What did we learn after Boston? We learned that tourniquets were really damn important, and that it wasn't all about surgeons, and it wasn't all about blood, and it wasn't about fancy stuff. It was about people strapping tourniquets on legs that saved lives in Boston. We need to take any lesson we can learn like that and make an impact from it. The local hospitals, so the 1/3, 2/3 rule. In most disasters, unless you can contain it. So if you have a tour bus roll over on I-90, it's pretty easy to contain that disaster. You can manage all those patients. The second you have something like this, or a hazmat incident, how many of those people, how many of those patients do you think will actually sit around and go through a triage area for EMS? Or how many of them do you think will actually just get in their car and drive to the local ER? History will show you that 1/3 of the patients will get transported by EMS and 2/3 will seek treatment on their own. And if we transported 1,500 patients that night, that means that there were probably 4,500 patients, all told, in that disaster. People will show up no matter what, and your hospital ought to be ready. That's exactly why we have a hospital liaison. Because if I call Kootenai Health right now and say, "How many patients can you take?" and they tell me, "Oh, we could take 4 reds and 10 yellows and 10 greens," what do you think I'm going to do? I'm going to send them 4 reds, 10 yellows, 10 greens, right up until they have somebody with an impaled object from the tornado walk into their ER, because that just took one of their code reds right out of my hands. Having that real-time information is incredibly important. And think about your outside resources. And no one thought about this. We encouraged all the hospitals afterwards to have lists of available resources for EMS. Where do you get diesel fuel in your little community at 3 a.m.? Because we had ambulances that had come from St. Louis and Kansas City and Tulsa who didn't have any idea where Parsons or Pittsburgh, Kansas was, let alone where the hospital was, let alone where to get diesel fuel at 3 a.m. was. Our local hospital, and so I wasn't there, did a great job. They had all the staff come in and all the docs were there, and they did a really good job. They fed all the staff. They didn't do anything for all these ambulances that were transporting in. They didn't have a way to where the fuel depot was or anything. So think about your outside resources. Area hospitals, I mentioned that that Mike Bettis said, "Oh my God, come one, come all, everybody come and help." Guess what? Stripped physicians and nurses out of local hospitals, reducing their ability to help. That was probably one of the worst problems we had that night. So again, internet systems are great, but they have their limitations. I know you guys use WATRAC. We don't have anything in Idaho. I wish we did. And honestly, more than that, I wish we had something better for the Spokane metro area to include us with real-time data, though. It only helps if it's real-time. I can tell you in Kansas City, we had 28 receiving ERs when I lived there. And if you did, if you did not participate, you did not get funding. And they had real-time MCI alerts and things to help that. So if you have an internet system, again, internet systems are great, but you've got to know how to use it and you've got to be ready to use it. Keep your people home and be ready for EMS to show up. If you have one hospital versus multiple hospitals, that makes a difference. So in our world, we have one over across the border. That is incredibly different than if we have two. For instance, if we have a hazmat release at I-90 and Highway 95, guess what sits at Highway 95 and I-90? Our hospital. Well, it's pretty hard to take all of the people drenched in methyl ethyl death to the hospital if you can see the methyl ethyl death from the ER. So you've got to think about that. And people say, oh, well, we're a small hospital. We don't have a role in a disaster. Well, if the disaster's in your town, you have a big role. And I would also tell you that we used the heck out of rural hospitals that night that didn't have surgeons and didn't have neurosurgeons and things with all the code green patients. And they set a lot of simple fractures and they sutured a lot of people and they took a lot of x-rays and they played a huge role and helped out a bunch. Never forget the other partners, mental health, tribal clinics, religious organizations. I can tell you that if you don't get a handle on this early, and, that you have all of these organizations that want to come help. You have the Baptist Men's Chainsaw Team. You have the Mennonite Women's Ham Sandwich Team. You have the whoever, and they're all incredible resources, but if you don't kind of gather them in and tell them the rules of engagement, you'll have a bunch of Baptist men wielding chainsaws out there in your path and causing problems. It gets to be a sticky wicket, so have a plan for how you're going to deal with that. Keep in mind then, you know, when the sun rises the next day, that the government shows up to help. And government agencies you've never thought of hearing about show up to help and think that they have a role. You've got to think about other medical organizations and finally your volunteer organizations. They all play a role and they're all key pieces. In the aftermath, you need to be part of it. You need to embrace it with history in mind. You need to use it to your advantage and you need to be the best that you can be. Do not think it can't happen to you. And so I'm going to preface this by saying, I realize the map that I'm about to show you, the only state in the country that did not have a tornado was the state of Idaho. I get it. That said, this is January 1st to July 31st, 2011. Every one of those red dots represents a tornado. There were over 1,100 and some reported tornadoes in that 7-month span in 2011. You know how many people the day before that tornado said, it'll never happen to us? 1,100 and some people. That map would tell you it can happen to you. So again, I don't show you this because I think we're going to have a tornado tomorrow and that's what I want you to prepare for. I show you this because it does happen. It happens all the time. We would think it would never, we would never have a terrorist attack. And I'm sure the people in Brussels said the same thing this week. Don't you think they said the same thing in Boston? Don't you think all of the places that this has happened, somebody has said, uttered the words, well, it'll never happen to us. So the onus is on you. Act now because it is going to happen. So you need to control what you can control. Guess what? You can't control the wind blowing 250 miles an hour. You very rarely, unless you're driving the tour bus, can't control whether or not the tour bus rolls over on I-90. You can't control whether or not the train derails and leaks methyl ethyl bad stuff. You don't have control over that. You have control over having a plan, having partners, having good communications. So you guys need to control what you can control. Never forget that people are going to do great things, but people look for direction. So you guys are the ones they are going to look to help provide that direction. The sun will come up. So that is the next morning over one of our triage areas. You can see the green and yellow tarps sit out there. That is on Main Street in Joplin. We had probably 60 or 75 patients through that triage center at midnight the night before, and the next morning the sun did come up. We live in the greatest country ever. We've established a system. We've done all these great things. We've granted people money to have a system. We've tried to build communications. We have great partners. Use them all to your advantage. Don't let that past you. Make memories. I can't fix that 161 people died. You know what I can do, though? I can make it so that 161 people don't die the next time, because I've set systems in place to prevent as much of that as possible. So with that, I am glad to answer any questions if you have them.